video for today. It is 26 days. Um, Today was a kind of crappy day. Um, I'm working on my master's degree, and it started a new term today. And I logged in, and the professor had a note that said anybody who may need to take any sort of time off during the term, maybe missing any courses, um, you may not want to take this course this term. And surgery or business trips or vacations are not valid excuses for having to turn something in late or have time away from the classroom. So that was pretty frustrating to see that, but I got pretty mad about it all day. I talked to my advisor, and he wasn't very helpful. So it looks like I'm just dropping the class, but I spoke to my mom tonight, and she said, you know what, it's probably better that way. Focus on yourself for the next 8 weeks, because my terms are 8 weeks for like an express master's degree. But yeah, she's right. Focus on myself for these next 8 weeks. That's what's important. So, yeah. So it's going to just be work and surgery and taking care of myself, and that's great. So, yeah. So tomorrow I'll drop the class with my advisor and just take the next 8 weeks off of school. So I wanted to talk about on today's blog posting about the process of going to the surgeon and what your requirements are, or at least what mine were. So for Celebration Health, their doctor is Dr. Keith Kim. He is amazing. He requires that you go to an information session first. So you go to their website and you can schedule to come in for the information session. And they're always on Wednesday nights at 6:30, but you do need to reserve your spot at the information session. They're really full. There's a lot of people going to find out and see if the surgery is something that they want to do. So they get you scheduled right away. So if you send in on a Monday that you want to come in and go to the information session, then they'll get you in that week as long as it's not, the room's not at capacity. But basically it's always every week at Wednesdays at 6 o'clock, I think it is, or 6:30, something like that. But yeah, so I went to the information session with my mom, and it was really informative. The doctor is not there, but his nurse, who's head of the program, is there. Her name is Sharon. She's really nice and really helpful, and just a super great woman. So yeah, so you go in and they ask you if you want to weigh in. You don't have to weigh in, but I did, and then that's when I had the shock of what my weight actually was. But yeah, I recommend weighing in. I think it's smart to know what your weight is at that point. So then it's about an hour long, and they talk all about the surgery, and they talk all about the medical problems that are associated with obesity, and they talk about the 3 different surgeries that you can have: the lap band, the gastric sleeve, and the gastric bypass surgery. I'm having the sleeve, and they answer questions. You can ask questions at the end of the session, and then at that point, you turn in your paperwork, and someone calls you to schedule your first consultation. So basically, they called me within a couple days, and they scheduled me to come in, and For me, it's a little bit different though because I'm self-pay. So I think like it might be a little bit longer if you're insurance, that they have to verify your insurance. And but because I'm self-pay, it was pretty quick. Um, so and it's like a weird process when you're self-pay. Like they give you so many options, like that you never even really think about when you're doing, all your normal medical stuff that is through insurance. It's basically like whatever insurance dictates, you must do. So it's kind of freeing to do it self-pay. So if you have the means, or if you can get a loan, or if a family member wants to help you out or whatever, I think self-pay is the way to go because you get so many options. They're basically like, whatever you want to do, you get to do. Um, so anyway, so they schedule you to come in, and I went in, and you first go into the office, and they get you set up with the hospital. And they set up your hospital account, and at that point, what we had to do, because I was self-pay, was put $1,000 down, which I don't think, there's nothing like that if you're insurance, if you have your insurance. But they do have you set up your account, so everything's all set up and ready for you to get your surgery later on down the road. And then Rose is her name, super nice girl. She runs the bariatric program, and she goes through everything with you. She's really detailed, and she basically, for me, because I'm self-pay, was like, this is how much it's going to cost for the sleeve, this is how much it would cost for the bypass, this is how much it would cost for the lap band, do you know which one you want to do at this time? And basically I knew that I wanted to do the sleeve. And you know what, I'm going to post the video about the sleeve so you can see what the sleeve is. They keep on talking about the sleeve, but I don't have the medical know-how really to explain it really great. So I'll post the video about the sleeve also with this video on the blog. But yeah, so Rose goes through all the pricing, and then she gives you your labs. They're like papers that are like a prescription for your lab. And so you have to do the H. pylori lab, which basically is a bacteria that some people have in their stomachs that can make you more prone to having, what is it called, ulcers in your stomach. And so you have to do that before surgery, and you have to be all clear for that. And you have to do that before they will even schedule you for surgery. And if you test positive for it, they're going to give you some medication to go on to get rid of that bacteria, and if you're negative, you're fine. I was negative, thank goodness. And then you also have to do, and the H. pylori is a stool sample. I did not know that, and I've never done a stool sample before. That's really gross. It's really gross, and I'm sorry if you have to go through that. I guess some doctors will allow you to do it through like a breath test, but the best way for them to tell is through a stool sample. Yuck. So if you're going to go to Dr. Keith Kim, just know ahead of time, for the H. pylori, you have to poo. Okay, so you do the H. pylori, you do a urine sample, you do an EKG, and you do a chest x-ray. You have to have all of those before you can schedule your surgery. So you can go and do those that same day, because those don't have to be done in any sort of time frame before the surgery. It just has to be done before they will even schedule you. So I went and did them all that day. Like, I was like, I'm gung-ho, I'm here, I'm going to get it done. So I went and pooped in the cup. I went and had my chest x-ray, and I went and had my EKG. And that was after, though, I met with office. So you go with Rose, and she gives you all your scripts for those things. And then you have your appointment with the office. I think I said before in a previous video that we had some sort of issue. They wouldn't take a check. So just know, if you're going to Dr. Kim's office, they don't take a check. You have to either pay with cash or card. So we get there, and I have to see Joe. Oh, he was a weirdo. He really made me feel like poop. I told him that I don't really see doctors because I don't want to hear that I need to lose weight, because I know I need to lose weight. But yeah, so he was a little, I don't know, I just felt like he was judging me, and that's exactly what I don't want from people, is I don't want to feel judged, so he said that I needed to go to a cardiologist, and I need to go to a pulmonologist because I never had a sleep study done or anything. And I do snore a little bit, but not super duper bad. So I've never, thought I needed a sleep study for sleep apnea or anything like that. So yeah. And then also you have to go to a psychologist. And you can use Dr. Ken's psychologist. I can't remember her name right now. Or you can use your own psychologist, whatever your insurance allows, or if you're self-pay, whoever you'd like. Just so you know, if you're self-pay, their psychologist costs $375. And the visit's about 2 hours long. But yeah, so then after Joe was done, who is the nurse practitioner, or there's also Michelle, who I'm seeing later this week, who I haven't met yet, but I hear she's a lot better. So then you meet with your patient advocate. My patient advocate is Laura, and she's awesome. Like I said before, she's this tiny little spitfire, and she's just such a sweetheart. And had I saw her on the street, I would have been like, oh, this skinny girl, she probably is judging me. But I don't feel like that at all. She's just been totally supportive. But yeah, she came in and she gave me the sheet that explains the phase 1 diet, and basically your goal is just to reduce your portion sizes and to stay away from white carbs and to have lots of protein and lots of fruit and lots of veggies, take a fiber supplement, and take vitamins, which I've done all of that, and to drink 80 ounces of water a day. That has been a struggle. I am not a big water drinker, and I'm trying very, very hard every day to get that water in, but it's tough. So after I finished with Laura, then I went and had the EKG and the x-ray, and everything looked great. Everybody goes, wow, you really, you look good for somebody your size. Your stats all look good for somebody your size. So I leave the appointments, and the very next day, I scheduled my appointment with the cardiologist and my appointment with the pulmonologist. Mind you, I've never been to a pulmonologist or a cardiologist, so I don't know what to expect. So the pulmonologist was first, and I had that a week later, and went to the pulmonologist, and thankfully, if your insurance isn't covering your surgery, your insurance may cover these other clearances that you have to go to. And so my insurance covered going to the pulmonologist and the cardiologist. So I went to the pulmonologist, and let me tell you, I was not expecting what had to happen. When I was on the phone, they said, oh, it's just a simple breathing test you have to do and an examination, and that's about it. That's all you have to do for your clearance. Well, you come in, and then they take you into this room, and there's this box, this glass box that's human size that looks like something out of a sci-fi film, and that's where they do the breathing test. So they're like, oh, step right in here and sit down, and this robotic arm is going to come down, and it has a little breathing thing that goes inside your mouth, and we're going to ask you to pant like a dog, and we're going to ask you to breathe everything into your lungs and breathe it all out. And you think you breathed it all out, but no. They keep on telling you to breathe out. Don't stop. Breathe out, breathe out, breathe out. Don't stop, don't stop, don't stop. Oh, my computer is blacking out. That's going to be lovely, I'm sure. But yeah, so they're like, breathe out, breathe out, breathe out. And I seriously thought I failed this breathing test because it was hard. Like, I don't even know what to say to prepare you. It was difficult, though. At one point, I was even tearing up, and my granny had come to the appointment with me, and I'm like looking over at her, and I'm like, is it almost over yet? Because she was a surgical nurse for years and years, so she knows so much about medical stuff, and she had never even seen this thing before. So I don't know if it's like this top of the line thing that this pulmonologist has, but whatever. So an hour later, after breathing into this thing, they finally tell me I'm done, and that I've finished the test, and they send me into the pulmonologist exam room, and he comes in and he checks me, takes the stethoscope and listens to me and blah blah blah, and I'm waiting on bated breath, like, am I okay? Like, did I breathe okay? And finally I say, how did I do on the breathing test? And he goes, oh, you passed it with flying colors. You did really great. You have really healthy lungs. He's like, you're cleared for surgery. And I just start crying. I'm like, yes, I'm cleared for surgery. And I'm like, I don't have to have a sleep test because of snoring. And he's like, no. He's like, you sound like you don't snore that bad. And he's like, I think whatever snoring you do have will be fine once you lose a little bit of weight. So you're good. You're cleared. First clearance, done. Then 2 weeks later, the cardiologist had a full book. So it was like 2 weeks later, I went to the cardiologist. I brought my EKG and my X-rays. I was ready. They asked me a few questions, and they gave me the clear. That was it. They asked me a few questions, and they did the stethoscope thing, and clear. Good to go. Again, crying because I'm so excited. And then left and scheduled my appointment with the psychologist. I was excited to go to the psychologist because obviously I like talking to people about my experiences, so I was like, yeah, it's going to be great to get stuff off my chest and talk to the psychologist. Well, before you come in, they give you this questionnaire that is like, I kid you not, 15 pages long, and it's like delves all into your past and, what were your parents like, and, all that psychological stuff. So I filled it out, like, I was really detailed, and some of the stuff I wrote a book, like, and then you go to the office, and then you have to do another questionnaire on the computer, fill that all out, and that takes about an hour to just do the questionnaire on the computer, and then you go in with a psychologist. Why can't I think of her name? Gosh darn it. Okay, but anyway, so you sit down with the psychologist, and she goes through all your questionnaire, and she asks you lots of questions, and basically it came down to, she said she thought I had a rebellious personality, and she was worried that I wasn't going to stick to eating healthy even after I had the surgery. So that was a little discouraging, but I guess she has to tell me that she thinks that. And then she also thought that I have an addictive personality and that I should never drink alcohol again or smoke cigarettes. I don't smoke cigarettes, but like don't use any substances at all. So I was like, okay, well, I don't really drink a lot. Like, she's like, well, because you have an addictive personality, you may trade food addiction for some other addiction. So I was like, okay, well, all right, I'm listening to you, and basically that was it. She gave me a clearance. So I called my patient advocate the next day and told her that, basically all my clearances were done. She should have received all of the faxes from the office. And so she said, within 3 to 5 business days, we should call you for an appointment. Well, it didn't. It took a little bit longer. It was about 2 weeks it took for them to schedule me for an appointment. I'm not sure why it took that long, but it did. So just know ahead of time that it could be 3 to 5 days or it could be 2 weeks that it takes to get that appointment. But that day that I got that appointment, that was such a good feeling. It was awesome. So then after you get your appointment, as soon as you're at that 30-day mark um, from surgery, you can have your blood work done. And you can't have it done more days out than 30 days. It has to be 30 days or less for your blood work. And so that's where we're at now. I just had the blood work last week. We have Wednesday my blood work and paperwork appointment to go over blood work and paperwork. And then next week is my pre-op appointment. And basically that is where I actually get to meet Dr. Kim in person, not just videos that they show me and not just reading his literature. Like, yeah, I haven't met the surgeon in person yet. It seems a little weird, and it seems like, how could you be so gung-ho about the surgeon without even meeting him? But they have videos that they show you that he, like, it seems like he's talking to you. It's really nice, and he just has so many patients that he can't see all of them every single time they come in the office. But yeah, so I meet the surgeon next week, and I meet with a nutritionist, and I meet with, and she'll go over everything, how to eat after surgery. And I also meet with the exercise metabolist, and he is basically going to take my BMI and my measurements, and he's going to go over ways to exercises to do to keep active while recovering, so that you don't get blood clot or anything like that. So that's next week, and then there's no more appointments again until surgery on September 19th. So it's exciting. It's great. So that's excuse me. So that's a little rundown of the process from deciding that you want to find out more about the surgery and going to the information session to right before surgery. I hope that helps somebody out there. I hope, it gives people some insight onto what I have been going through. And that's it. So don't forget to like, don't forget to subscribe, don't forget to share with people. This is what this is all about, getting, my story out and helping people. So thanks for watching. Bye.